Hi there, my name is Celine and I'm a Doctor of Clinical Psychology research candidate in my final few months, and together with Dr. Megan Turner, who is a senior clinical psychologist and a clinical educator, we are presenting on teaching psychology trainees fundamental therapy skills through participation in an online CBT group. So I'll speak to what the online CBT group is, and then we'll speak to the trainee experiences of participating in this group, and then I'll hand it over to Megan, who will speak to the clinical educator experience. So the reason why Deakin offers a CBT group is because teaching CBT meets the accreditation requirements for teaching evidence-based practice. And just as a reminder, as a brief introduction to what CBT competencies are, I've included the Roth and Pilling model. There are more competencies to this model, but for the purposes of this presentation, this is kind of sufficient. So they speak to generic therapist competencies, such as being able to set up a collaborative therapeutic relationship. Basic CBT competencies involve those that are kind of shared across different disorders, such as being quite aware and understanding the rationale for CBT, and also being able to explain that to a client in plain language. And then more specific CBT competencies, such as, with mood disorders, knowing what behavioural activation is and how and when to apply that. So self-practice, self-reflection is a teaching method that's really growing in appeal, as it's a personalised experiential learning method which is showing significant promise in developing CBT and kind of other therapeutic competencies. So what it involves is a trainee or a professional therapist will practice CBT tools on themselves and then will reflect through a formal process on what that experience was like and how that teaches, or what that teaches them about their future work as a therapist. So there's really been a proliferation in research in this area, and things like trainees and experienced therapists alike reflect on having a deeper understanding of what CBT is and on how to implement CBT tools. Also better understanding and empathy for the client experience, and things like understanding how self-disclosure can feel very uncomfortable, but also thinking about how you can facilitate that experience with the client as a therapist. So the CBT group that Deakin has integrated into the first semester clinical psych interventions unit for masters and doctoral students, the clinical psych program, is based on the mood management group, which is a CBT psychotherapy group that's been used, developed for those with anxiety and depression. And it's been adapted to include self-practice, self-reflection, so integrating that therapist role, so where the facilitator will guide that reflective process. So generally speaking, 2 or 3 clinical educators and 8 or 12 trainees will participate in the group, so depending on how big the cohort is and whether it's face-to-face or delivered online. So prior to last year, this group had always been delivered face-to-face, and last year there was the opportunity to adapt this group to an online environment, and really thinking about how that would support trainees' understanding of what telehealth felt like. So my research has mainly focused on the acceptability and the feasibility of this teaching method online. So I'll speak to that over the next 2 slides. So we found 2 kind of main themes. So trainees talk about having a deeper understanding of the benefits of a CBT group. So being better aware of their own unhelpful thoughts, beliefs and behaviours, and better able to address those in the moment. But also that experience of hearing their colleagues sharing similar thoughts, beliefs and behaviours got them to understand, I'm not alone in this. And so that really facilitated that positive group bond. Trainees do report mixed views about vulnerability online, where some say, actually, I think the group got much deeper online than we would have face-to-face, and some saying, well, actually, I did feel quite uncomfortable being vulnerable online. And so I kind of kept it more at surface level. And so trainees talk about wanting more opportunities for incidental bonding and debriefing because they talk about, you start the group and you're kind of straight into it, and then you have a break, and then you go for maybe a walk or you do something at home, but you don't have that opportunity to quickly have, like an incidental bonding chat with your colleagues. And trainees do talk about wanting more clarity around confidentiality, which is quite interesting because this has been a theme across recommendations across the different years. And so over recent years, we've really tried to be clear about confidentiality and revisit that over the different sessions. And so there's potential for trainees to really want a list of things like this is okay and this is not okay. And so we wonder whether that's perhaps a bit more of that, experiential avoidance, wanting clear answers to avoid, experiencing that discomfort of not knowing. So something I guess we're reflecting on. And then trainees talk about a number of professional learnings, very similar to face-to-face groups in previous research, but also particularly in this group, there's been that kind of shift from being really not keen to engage in this group online because they thought it won't be possible to conduct this group online, but also that it wouldn't provide a similar learning experience. And through being exposed to this group and engaging in this group, trainees talk about being really challenged. Those preconceived ideas were really challenged, and getting a better understanding of how to actually apply CBT to a telehealth setting. So needing that clearer structure because it's very easy to go off topic. Understanding how to communicate online, what kind of methods we use to manage quieter individuals, but also manage those who are very keen to speak online. So I'll hand it over to Megan now to speak to the facilitator experience. Thanks so much, Megan.
Thanks, Celine. As Celine mentioned, I'm here to talk about the perspective and experience as the clinical educator involved in delivering the mood management group online. As you can probably imagine, it was a very steep learning curve for myself and the other two educators involved in the delivery of the program, particularly because none of us had any pre-existing clinical experience in telehealth. So this was a very new experience for all three of us, which led to us having some assumptions about the acceptability and feasibility of the idea of shifting to an online delivery of the mood management group, most of which were challenged by the end of the program. Initially, we had some concerns around the content of the program and how that would translate to the online context, and some worries that we would not be able to cover as much content and that it would be a different experience for the trainees in terms of what they learned with regards to CBT competencies. We also had a concern that the group process or group dynamic would be different in an online environment. And by different, we were really thinking it was going to be of lesser quality to the in-person experience. I think it would be fair to say that by the end of the running of the program, we were all in agreement that it wasn't necessarily less or necessarily more online, it was just different. Importantly, this was a shared experience for the educator team and the trainees. All of us were relatively unfamiliar with online learning or online experiential learning, and certainly not at this intensity and frequency. So that was a really important thing to lean into in terms of normalising all the Zoom fatigue and the Zoom fails and things that just didn't land in the way that we had assumed or hoped. And it was a really good point of shared connection. Importantly, as Celine has already shared, one of the key or unique aspects about the mood management group is the experience, the opportunities for self-reflection and self-practice of the CBT skills. So everything that did go wrong, which wasn't a lot of things, but the good, the bad, and the ugly were all opportunities to learn, and that was a really helpful culture to create for the group, and that really enabled their learning and effective use of that group time. So in summary, really, we shifted pretty quickly from clinicians with relative expertise in CBT delivery to novices, in the sense that none of us had experience doing online therapy of any sort. So, like all good psychologists, we sat down and debriefed and looked at the research and put on our scientist practitioner hats and looked at how do we adapt what we know into the online format. We found that a lot of what works in person fairly neatly shifted across online. One example being in session 1 or 2, we do a hot cross bun formulation example. In person, we would get up on the whiteboard, do that, get some group input. Similarly, running the same thing on Zoom using the whiteboard, not overall, not a very different experience. Some of the things that were different were the mindfulness exercises. Easily translate in terms of how we deliver the mindfulness exercises, but the experience for the trainees was different in that in a room, it's a shared experience. We can get a sense of how others might be responding to the exercise, and as facilitators, we can see how trainees are responding and reacting. Online, we would invite for the mindfulness exercises that they turn their cameras off if they felt more comfortable to do so. Most of the trainees did do that, so it just meant a different form of feedback to gauge reactions and responses. The other thing is online, we could actually introduce some tools that we might not use in person, such as the occasional use of a little video clip to promote discussion and learning. Some of the things that we were learning online in our teaching, then as we shifted into telehealth practice with clients, we could then translate, and that was certainly the tools around how do we engage people online, how do we create safety, how do we be creative in our use of the online tools, and that importance of feedback. So we kind of came full circle and moved back into that expert role to some extent. The things that we found really helped with adapting the mood management group to online with clear rules and guidelines to create that safe space. We certainly did that very explicitly and deliberately in the first session, revisited that in session 2, and continued to touch base around that each session. We certainly worked hard and were very deliberate in our seeking of feedback from trainees, and that was through talking, asking questions, encouraging them to ask one another questions, but also through the chat function, using emojis, emails, all those kind of things. Engaging people online, we found, like many of you probably have learned through the last year and a half, the importance of scheduling in breaks, and they were more frequent than what we would have in in-person teaching. Certainly use breakout rooms whenever we could, so that people had that sense of a safe space to connect and be vulnerable. Working in a really deliberate way to create a culture of flexibility, I think was important for all of us in adapting and being forgiving if occasional mistakes were made or we weren't sure how to manage something online. And certainly a nice healthy sprinkling of playfulness, I think, is always really helpful, particularly in the online context. So I got to meet lots of pets and children and the occasional delivery man, and that was all done in a playful way. This year we had an online or a blended delivery, so a combination of online and face-to-face modality. I did find that was really helpful for the trainee learning, because they really had rich opportunities to reflect then on their experience of being a participant and co-participant, both in an online therapy group and a face-to-face therapy group. So that was a really fantastic opportunity for the current cohort. I'll just wind up by saying telehealth is here to stay, and I just think having clinical skills in that area is going to be so helpful moving forward. And the online mood management group is a really unique way to experience, practice, and reflect on the development of CBT skills. Thank you for your time, everyone.
So thanks so much, Megan. These are our contact details if you wish to ask us any other questions, but of course we've got a few minutes after this presentation. And here are some references as well. Thank you.